Okay, welcome everyone to the side event on harm reduction, drug use and the right to health. I'm Gloria, so I'm the Regional Director for Asia for the International Drug Policy Consortium, IDPC. And IDPC is a global network of around 200 NGOs around the world that promote human rights and social justice in drug policies. And thank you for the co-organizers working with us to organize this event. So I think today one of our key topics is around harm reduction, and this is a topic that has gained a lot more visibility in the past few years in the United Nations and seen as an essential part of the right to health. And we see this in particular in the UN human rights system. This is particularly evident in reports that have come out over the past few years from the Office of the High Commissioner for Human Rights in 2015, 2018, and 2023. We also see this recently from the UN Special Rapporteur on the right to health, as well as in the concluding observations made by the UN Committee on Economic, Social, and Cultural Rights. And of course, we can't leave out that last year was a really important moment for the UN Commission on Narcotic Drugs when a resolution 67/4, was adopted last year with the words harm reduction, recognizing harm reduction and including those words as well. It's important to note also that harm reduction is promoted and recommended in the UN system common position on drugs. But yet, despite these wins in Vienna, there's still reluctance from UN drug control agencies to elevate and promote harm reduction as a human right. And this is seen clearly. We've seen this in the UNODC's World Drug Report, the one that was released last year with a special chapter on drug use and the right to health. And in response to that, IDPC has released a response. And so there's a report that you can see on our website or scan the QR code to kind of get a copy of it to see the IDPC analysis of the World Drug Report and how they've responded to the use of drugs and harm reduction. On the ground, harm reduction services around the world continue to be inaccessible for so many people. They are really severely underfunded and at constant risk of being shut down. And while a majority of countries continue to impose severe sanctions, punishment and penalties against people who use drugs. So the side event here today is an opportunity to reflect on these realities in different parts of the world and to discuss the urgent need for reforms. So we have an amazing panel of speakers today, most of whom are joining us in person here, and also Anand Grover, who will be joining us online. But our first speaker we'd like to invite is Zaved Mahmood. He is the Human Rights Officer for the Office of the High Commissioner for Human Rights. So Zaved, I'll pass the microphone to you.
Good afternoon. Thank you very much, Gloria, for giving me the floor. And also, we are really pleased to co-sponsor this event. Before I make a statement or remarks from my side, I would like to make one announcement that we are going to submit all the side event which we are co-sponsoring, put in a document and submit to the CND as a conference room paper for next year. This year also we did, last year 7 human rights, 8 event we organized, and now it is on the CND website. You'll see that conference room paper submitted by Czechia on behalf of Switzerland, Colombia, and Switzerland, Czechia, OHCHR, and IDPC. So we are going to do the same next year, so we'll be happy to receive good contribution from this event. With that note, I would like to start saying one line first. Harm reduction saves lives. We can't contradict with this statement. So we have evidence that in our report we have produced and shared, and later on 2023 report, I have few copies, summary, please take here, also in French and some maybe Portuguese, please take from here. In the report we outline that why harm reduction is needed and what framework it should be given from the human rights perspective, that is right to health. When we are talking about right to health, that means it has to be access to harm reduction and treatment services has to be affordable, accessible, and it is quality as well need to be maintained. With that note also, I would like to refer to a Special Rapporteur on Right to Health. Last year, she has published 2 reports, one to the Human Rights Council, focusing on harm reduction within the framework of right to health. And also to the General Assembly, she submitted last year another report on harm reduction, looking at from the perspective of sustainable development as well as peace context, peace mandate or peace context or post-conflict context to how to harm reduction to looked at. With that, making reference to those documents, I hope that you look at those documents and those particularly Special Rapporteur document identify various measures what should be considered as a harm reduction. One thing she has done, I think a lot of colleagues in their contribution also mentioned, harm reduction is not only the scientific treatment related issue. Harm reduction also include decriminalization. Harm reduction also without decriminalization of drug use or decriminalization of different measures, harm reduction will not work. I would like to give you 2 evidence on that. Just last 2 days in different meeting I'm attending, yesterday one country from North Africa, I'm not going to name, they introduced harm reduction, particularly methadone program, but people doesn't want to come forward to receive those programs because drug use is criminalized. They are afraid to come. Health Ministry is doing one initiative, but they know that there is a connection of the different ministry. They are afraid to come forward to taking. Patients' number is not that. In another country in the prison, OST has been introduced as a harm reduction, but prison population or prisoners, they are not coming forward to take that services because they are afraid because they will be criminalized or their punishment will be increased in the when they are already in the prison. So those contexts also we need to look at very much comprehensively, that harm reduction. Also, I would like to mention that when we are talking about harm reduction measures, treatment, or even decriminalization, will not successful if it is not looking at from comprehensively. For example, we have discussion yesterday, this morning as well, heard from our colleague from Brazil that they are considering that it has to be looked at the drug policy situation or issue comprehensively, socio-economic issues, for example, livelihood, or it is related to the unemployment. Then drug use related to some cases unemployment, particularly within the youth context, or homelessness. We know that how homelessness contribute to this crisis. Without addressing those issues, only having harm reduction or treatment or decriminalization will not work. We have seen recent time in many contexts that even introducing, legalizing things, situation is reversed because all these other services has been reduced. It didn't work. So we need to also think that issues very carefully, that comprehensively looking at this issue. Last issues I would like to mention in our statement to the CND yesterday, also this morning, we highlighted one issue, funding. And also I think that Switzerland had a really good event on Monday on harm reduction. I raised this issue, the funding consideration. In this crisis time, we need to work together how to face this crisis. And I think I would like to again refer to our Deputy High Commissioner, her statement to the HIV panel last week, where she mentioned cutting funding is not only cutting funding, cutting future of many people future. We are cutting off many people future through that process. It is an issue of life and death. We need to also think about that when we are facing this issue. Just now we are having another event. I will take 1 minute, not 2 minutes, 1 minute. Another event we are having, youth and harm reduction education. that issue has been not that much looked at it. Even whatever drug education program we have seen or different partner developing, the harm reduction education is not fully included on those activities. And it is really important that we need to focus on the youth as well, and harm reduction education should be one of the priority. With that note, thank you very much. Again, over to you.
Thank you very much, Zaved. Sorry, stopping my timer. Yeah, thank you also for highlighting the very comprehensive nature of harm reduction and how to make it work. It really needs, it's connected to so many different things around social needs and around the legal system. And so all those other things need to be addressed as well to make it effective. Thank you. And I think to take that further and to focus on one of those particular factors, criminalization, our next speaker would be joining us online. Is Anand Grover from India, and he is previously the UN Special Rapporteur on the right to health, and is also a member of the Global Commission on Drug Policy.
Thank you, Gloria. It's a pleasure to be here, and also, I'm sorry I couldn't be present in Vienna, but I would like to, take a step back and address more fundamental issues, which include the harm reduction issue. I think it's very important when we are discussing harm reduction that we do not forget the overall context of how the three conventions have actually harmed not only the health of people, but harm reduction policies. And I think we should step back and just quickly, I'll go through the main points I want to make. First, the World Drug Report doesn't recognize traditional drug use for medicinal purposes and recreational purposes. And that's a major flaw. Secondly, it doesn't recognize that, and this is a bane in the total flaw in the reasoning of the World Drug Report, because the conventions have been brought about and the Special Rapporteur has addressed it. And let me make it clear that I fully endorse the two reports of the Special Rapporteur, and I also endorse the IDPC analysis on it. I'm not afraid to say that. I'm very proud to say that. The second point is that the drug conventions are cultural imposition of a cultural notion of drug use. Simple fact that alcohol is not actually considered deleterious shows you why it is actually a cultural imposition. Cannabis is actually good for people, but it's banned. That's the second point. Third point is the conventions. Now, there are very important technical and legal points in the convention. First thing is that the conventions themselves talk of alternatives to the nature of imprisonment in other forms of deprivation of liberty. That is not considered at all by any of the World Drug Reports. Secondly, all treaties internationally always say that implementation of treaties have to be according to the due regard to the constitutional, legal, and administrative systems in the country. But the way the drug conventions have been implemented is that they've completely forgotten this. The ideological stance which is taken by the CND has been imposed on countries. In our parliament, a lot of MPs contested following the drug conventions, but they were shut up because that's a requirement under law. For example, burden of proof, whether a person should show that he or she did not have possession, conscious possession, is reversed in India. Alternatives are not looked at. The burden of proof and constitutional values are not looked at. Now, the World Drug Report actually talks of adverse consequences of people using drugs. It conflates the person using drugs and a person who's drug dependent. They are the same for the World Drug Report. So the moment I start using drugs, I'm a person who's actually sick for them in the social sense. That is an ideological precept which the conventions carry. And once you do that, it's all right to have considered a person using drugs to be a person doing social evils. Therefore, criminalization is the natural thing. And whereas we know very clearly that drug use and drug dependence are completely distinct things. And in that context, the World Drug Report actually then saying that, people in the family of a person who's using drugs, the children and third parties who associate are also affected, shows the way the notion is carried to its logical conclusion. So I think in that context, I will support Zaved in saying that harm reduction cannot be looked in a silo. You have to actually tackle criminalization by positing decriminalization. We know the effects of criminalization. For example, I do a lot of cases on drug use, and fortunately, a lot of people have got them out on bail, but it's very, very difficult. Moment I go to court and the judge says, oh, it's a drug user. That's it. It's very difficult to argue because the notion of social evil has been imbibed by our societies, though we have been traditional drug users. Cannabis is even used. Today is Mahashivratri, or tomorrow it is, and we actually have bhang legally, okay, which is cannabis. But all other drugs are prohibited. So we are living in a dichotomous world. But we know the effects of criminalization. Criminalization actually destroys people, not the drug use. It is the criminalization which takes away liberty of a person. That person is then isolated. That person's family is destroyed because they have no income. The children have a bad future, etc., etc. I don't want to get into it. So I think when we talk of harm reduction, we should actually focus first on criminalization. I'm not saying that you are focusing, but I think if you talk of harm reduction alone, we will not succeed. But in the World Drug Report, the concept of decriminalization is not in their thought universe. That is a very sad thing. But I must say that the chapter on health actually is a gate for us to actually intervene in and then start talking about that. So that's a positive thing, but I don't want to get into too many positive things. There are not many. About children and families, there's absolutely no substantive evidence showing the ill effects on family members or children or third parties who associate with a drug user. And again, this is an ideological stance which has to be rebutted. Now, harm reduction is very, very important. But harm reduction has actually been propped up as a strategy, rightly so, because you have criminalization. And it's a non-judgmental stance. And it proved to be very effective in all countries in terms of, in the context of HIV, but it's gone beyond it because we have cases of overdose. So we know that harm reduction is very important to give information, to make information accessible, and also drugs to suit the person so that person doesn't actually have failure. Now, in terms of the law, in terms of international law, several UN mechanisms, including the rapporteurs, have actually stated very clearly that it is the part of the right to health. To ignore that is a tragedy for the CND. And the other point that is very important to make is that as far as the CND is concerned, it lives in a silo. It's isolated itself from the UN human rights mechanism. And that's a tragedy, actually, because the moment they start engaging with the human rights mechanism and leave their ideological stance behind, they will realize that what they're doing is actually harm. Finally, one of the ironies is that the CND and the the World Drug Report, World Drug Report doesn't recognize that the country which started the war on drugs, the US and President Nixon, they have understood its failure. And they have decriminalized. It's like I always say, English people imposed on us in India the criminalization of same-sex relations. We imbibed it as our own culture. And when I was arguing it once, I'll finish with this, one of the ministers who was there in the cabinet, he was in debate with me on television. He said, no, this is our culture. Our culture meaning we actually think that it should be criminalized. Whereas historically, India never criminalized same-sex relations. That was the norm to have the third gender. And that is one of the bases why we decriminalized. But it's the same thing with the war on drugs. The irony is the US has actually decriminalized. The CND has not taken notice of it. Because if you take notice of it, you will realize there's something very much flawed in your thinking. And the war on drugs has failed. Can they not realize that? More and more people are taking drugs. More and more people are going to jail. In India, also in the north part of India, 50% of the jails are filled by persons who have been caught for drug possession. Not even use. We don't know whether they use, only possession. And even judges are getting frustrated. What are we doing with all this? So the World Drug Report, in trying to actually put this chapter and trying to argue that the right to health and the international drug conventions can coexist, is a contrived attempt to succeed in something that you can never succeed in. Because under the International Human Rights Convention, the Charter of the UN makes it very clear, if you read Articles 51, 55, and 56, that promotion of universal respect for and observance of human rights and fundamental freedoms is primary. And 103 makes it clear that even in the event of conflict between human rights and any other treaty, human rights will supersede. So obviously, the human rights will succeed and actually dislodge the treaties. This is a new argument I'm putting forth. Actually, we are going to take some steps on this, but I want to stop here because I don't want to take more than my time. Thank you very much.
Thank you very much, Anand, for touching upon a broad range of topics relevant to both criminalization and harm reduction. You touched upon a lot of things, and I think if people had questions, Anand will be still stay with us until the end of the session. Yes, thanks you, Anand. And I think maybe also to continue, maybe commenting on some of the issues raised by Anand is Ahmed Said. He's from Kenya, and he's the regional coordinator for the African Network of People Who Use Drugs. Ahmed.
Yeah, thank you so much, Gloria, and let me say thank you to everyone who made it to this side event, and special thanks also for the IDPC, because in the midst of crisis, they made it possible for me to be here, and I don't take that for granted. In today's, my presentation is just to show how important it is to involve the people who use drugs. And it has been said, I have been working now for a year and some month at the office of the African Network of People Who Use Drugs. Historically, I don't need to repeat, because how we exist is in the internet under the Vancouver Declaration. And as we are looking for this today, we should recognize that whatever war we are talking, war against drugs, it has been always war against the people. It hasn't been really about drugs, it has been about the people. And people have been framing drug use as inherently problematic because people have not want to recognize that they are a harmful policy that are culprits of problematic. Actually, my own journey, if I may say, is bluntly illustrate that in the year 2006, December 22nd, I was arrested because of only three sachets of heroin. And I spent 5 days in a cell. Later on, I was convicted guilty in a prison. And up to date, I have a criminal record just for personal consumption. Instead of helping me, there was no painkiller, there was nothing, there was no counseling or anything. But they exposed me to more pain and more stigma. So the term problematic drug use is just to polish the complexity of our experience. In reality, we don't have problematic drug use. We have defective policies that encourage discrimination and health risk among the people who use drugs. So it is important, as from the Human Rights Commission, from different member states, to start redirecting issue from individuals to the system that perpetuate risk and menace against the people who use drugs. With this, we are able also to champion equality, equitable, and having a social-centered approach towards the harm reduction program. So, by involving also, the other thing I want to talk is about involving the people who use drugs in program. It is very essential because our voice from local grassroots movement up to international platform have been very crucial in shaping harm reduction policies. Instead of blaming drug use, we must challenge this narrative and address policies that harm the people who use drugs. It is evident that anytime you involve the people who use drugs actively in advocacy, the results are very transformative. Yeah, our Inside Foster Harm Reduction Initiative and the community change by time drastically and progressively we see changes. The good example is in Kenya in the year 2012. I was the first daring character to take needle and syringe to the people who use drugs. There was a program by then which was funding harm reduction program to the civil society, but they didn't know how to take. They wanted people to come at the dropping center where people are not used to. But I was the daring character. Until today, Kenya is proud to say they have a vibrant needle and syringe program. But it was just a daring character. In the midst of opposition, in the midst of religious connotation, in the midst of cultural connotation and social connotation, I was able to dare. And today, they have even a legal notice to make sure that people who distribute needles and syringes are protected. This collaborative approach not only transforms public health outcomes, but also build trust among stakeholders. By empowering people who use drugs as key participants in policy and decision-making processes, we can establish meaningful, responsive, and drug use that emphasize health, human rights, dignity, and safety. And I also align with Zaved, who said that people, right now as we speak, there are people who woke up hungry, they will sleep hungry, they don't know where they're gonna sleep at night, they are in the street because of the bad policy and the bad environment that has been put. In this way, we are ensuring that that's why we need to make a very strong commitment to maintain the 30-80-60 community-led response so that we might achieve the 2025 Global AIDS target and also 2030 Sustainable Development Goals that targets on health. By fostering inclusivity, dialogues, and that incorporate the expertise and experience of people who use drugs, we can advocate for community-led harm reduction strategy that are driven and for people who use drugs. The evidence is clear. When people who use drugs are at the forefront of this discussion without being tokenized, the result is better tailored intervention and a safer, more supportive society for everyone. Ultimately, it is through this inclusive model that we can dismantle the barriers created by ineffective policies and pave way to ensure that people have a healthier future. One thing I want to finish by saying is that the war against drugs is about few individuals who want to remain in power. It's about few individuals who want to take control over the right of the people. As a human rights activist, as a human people who are inherently human right, we believe that drug use is part of our human right. I submit. Thank you.
Yeah, thank you very much, Ahmed, for sharing a really valuable perspective, and also for your courage in taking risks to protect the lives of others and showing us how it can be done. But hopefully this is an area where people don't need to keep taking risks to their own lives in order to try to save others. Thank you, Ahmed. And I think an issue we wanted to highlight is around the situation with funding, the support that's given to make harm reduction interventions sustainable. Many of us are aware of the cuts from the US that has led to a funding crisis, but actually even before that, there was already a funding crisis, and I think many advocates and activists who have been working in really challenging environments for a long time, and one of them is Yuliya Georgieva from Bulgaria, and she's a chairperson for Center for Humane Drug Policy there, and we look forward to hearing from you and your work in those challenging contexts. Thank you.
Thank you very much, Gloria. Thank you to IDPC and our co-sponsor of this event, that for the first time in my life I will have a chance to share some positive experience. I'm working in this area for 25 years, and this is my first time. So the whole story started very far away. The first harm reduction organization was born in Bulgaria in 1997. Can I ask for the next slide? Thank you. And after 20 years of working in the field, unfortunately, in 2017, all harm reduction organization in Bulgaria closed. Our activities was absolutely stopped, and our harm reduction organization closed. This is the time when we've just founded the Center for Humane Policy, because we believe that we need to work with the policy. And the policies are the weapon to push the government to make proper harm reduction. But in 2019, we understood that, okay, it's not going to happen without any kind of services, of course. And we decided to try to save the only place in Bulgaria where the people who use drugs had a chance to go for a while. We named this place the Pink House, and in those days we didn't have any cards. We didn't have any money. We didn't have any support, and we didn't have a lot of expectation that the government will react somehow adequately. So we decided to ask the people. And we make a huge Facebook campaign to receive, for the first time, it was €700 to have a chance to sign the contract with the rentier of the house, and to have a chance to save the house. We have a chance to receive those money for 3 hours, which was absolutely amazing. It was the first miracle, because Bulgaria is a country with very high levels of stigma and discrimination against people who use drugs. But it happens like that. After that, the COVID-19 came, and we need to survive somehow. And again, the crowdfunding was the thing which helped us to survive during all these very, very hard times. Another miracle happened in 2023, 2 years ago, when the Sofia municipality finally recognized the needs of harm reduction and the needs of these activities, and together with Ministry of Social Welfare, for the first time, they gave money for social services for people who use drugs. Especially we are working with the most vulnerable people, with the most vulnerable population, people who inject drugs, the homeless people, people who doesn't have IDs, social insurances, or health insurances. During the same month, the Elton John AIDS Fund supported our project, A New Start Registering Harm Reduction Services in Sofia. It was absolutely amazing how it happens in the same time, because the Sofia municipality at the moment paying for the social inclusion of the people, but the Elton John gave us a chance to start outreach activities. Again, I mean, I used to be outreach worker for 12 years before that. In the same year, we applied for the public tender of the Ministry of Health, which is about HIV, and also during all this time we have some small support by National Center of Public Health and Analysis, who are very good guys who really tries to do something, but unfortunately they have no money. Next slide, please. So this is the picture between 2020 and 2024. Most of the people are coming for crowdfunding. The second pillar is the money from National Center of Public Health and Analysis, and the gray two are the money who are coming from in 2023, after 2023, after middle of 2023. These are the amount who are coming by the Sofia municipality and the Ministry of Health for HIV prevention. I'm not allowed to tell what are the amount of money which UHCHR gave to us. This is what it is. So thank you. Another slide, please. So the result after we started the outreach works in Bulgaria after 7 years of gap. Between July 2023 and December December last year, we reached 1,614 individuals. Those are most vulnerable people in Bulgaria, in Sofia. Especially in Sofia, where we made 8,317 contacts with them. And we had a chance to test more than 1,000 people. Unfortunately, we understood that the rate of HIV among those people are very, very high regarding the population. And there are 9.1% of all people who we were tested are people who live with HIV. And it is a little bit lower, I think. Almost 50% has Hep C. It is very pity because in Bulgaria, Hep C is not easy to be treated for people who are not who doesn't have health insurances. So most of these people doesn't have chance to be treated from Hep C. Because of this project, these results are from the project of Elton John AIDS Fund. Just for several months, we increasing the percentage of people who live with HIV among the group of people who use drugs with 3.6%. This one organization in one city. Can I ask for? Yes, thank you. So what's happening at the moment? On the 7th of February now, it is 1 month ago, we initiated a roundtable in the parliament to ensure some kind of understanding among the politicians what demand reduction means. I mean, the whole focus of Bulgarian politicians is regarding the repression. They really like the repression. In 2021, we made an analysis of funding, And the situation is that, the situation is that 10%, only 10% of all funds are for the people who are for the demand reduction, for prevention and harm reduction. So next slide, please. Okay, it is not so important. Maybe the previous one was so important that after the roundtable, we initiated a temporary parliamentary group, and it is going to start really now. Tomorrow, my colleague will be part of the group of people who are going to meet the president. And I really hope that this time our politicians will understood the problem finally. Thank you very much.
Yeah, thank you very much, Yuliya, for sharing about that. And I mean, I know it's really challenging, but it's also impressive to see the extent of the fundraising you were able to do through crowdfunding, for example. We have a time for question and answer, for Q&A. And I think, yeah, and Anand, I think is still online if people have questions for Anand as well. But yes, I'd just like to ask if there's anyone has something that they would like to share, questions. Thank you, Anand.
Yeah, I don't know. I just like wanting to know what's the timeline. Like what is it looking like? I know government takes a long time. First of all, my name is Klaus Marte. I'm the CEO of Combud. I have 3 legal dispensaries in the state of New York. I'm the first social equity person to open up 3 locations in a matter of 15 months and be able to box out the medical operators in the market of New York and have over 200 people work who have been formerly incarcerated to run these businesses. Long story short, I want to know, like, what's the implementation, what's the timeline, you know, like the gentleman on the screen, India, you know, you're talking about there, what does that look like? Because I told this gentleman from Norway that I was going to legalize everything in 7 days, you know, so I got to give him an answer. But no, that's just my question. You know, when do you expect things to really make a change?
Well, you know, decriminalization has been on the agenda of all people working on drug use, HIV, hepatitis C for a very long time. In the last 2-3 years, there are companies who, after seeing what has happened in the US and Canada, more particularly the US, see a fortune to be made on legalization and particularly cannabis. So there is some move afoot to legalize cannabis. But this particular government is, what shall I say, not very favorably inclined to drug use. And they've vowed a number of times to get rid of drug use from India forever in the next 5 years. But there's a contradiction because traditionally we have been taking drugs. And in fact, tomorrow is one of the days where we actually take bhang. Bhang is legal in India. It's actually a particular feature in the narcotics law. But I don't think we'll have legalization soon. But we try to make sure that the government realizes that the US and other countries, Portugal, etc., have decriminalized certain drugs. And actually that has been beneficial not only to the drug users, I don't like the expression at all, but government needs to know these things and it'll push towards decriminalization over the next period. But there's no timeline, I'm sorry. It's a very difficult period in India on a lot of other issues also.
Thank you.
I hope that answers the question.
There's no timeline, basically, yeah.
I'll tell my Indian friends.
Okay. I know that Zaved wanted to add a comment, but I wondered, was there any other people had questions, or even if you wanted to share a bit, I think, on your experience or your perspective on, I'm sure a lot of the issues that were raised by the speakers here have resonate, or people share similar experiences in different contexts.
May I request Maria Grothi, what she was mentioning in our meeting this morning, that initiative to giving legal framework to the harm reduction That would be really interesting experience from Ghana.
Okay, thank you very much, Zaved. So basically, my country, and about 2 or 3 years ago, sought to reform the law and to take initiatives that can improve the lives of people who use drugs. So we sought to remove criminal sanctions, especially custodial sentences for persons who use drugs, and rather impose some amount of fines. We also sought to introduce harm reduction, being recognized as a legal framework within which people can seek services for drug use. Now, I was telling the last panel that over the years, especially around Africa, we've seen initiatives around harm reduction. And of course, most of these programs and services have always dwelt on the goodwill of governments. And over time, we've seen how some governments, changing governments, have rolled back some of these services. And it's important for us to begin to look at how we can put these services within a certain legal framework that are protected, to allow them to be run irrespective of whoever is in power. Because over time, we've seen how these things roll back because somebody comes to power and says that I don't like this program and it's not something I'm going to put money in. But once there is a legal protection of that particular service, it is difficult for a government to come and then do that. And that is exactly what we have done as a country. We have introduced a legislative instrument where harm reduction will be recognized legally as a service that will be good for people who use drugs. And I believe that this is something that civil society, we should be pushing in our respective countries, where we can have a legal instrument that protects these services, so that when somebody comes to power, you can't just get up and say that I don't need this, and so I will not invest in it, or I will not put money in it, and I'm going to roll back all these things, because we know that to repeal a law is a process. And of course, nobody wants to go through that hectic process of repealing laws. Thank you very much for the opportunity.
Thank you, Margaret. Yes, I would like to, which I wanted to mention, I didn't mention that international guidelines on human rights drug policy. In these guidelines, there is a whole 1.5 page on the harm reduction and what does mean by harm reduction from human rights point of view. Exactly this issue, the giving protection, legal protection to the harm reduction, it would be so important for sustainability. We can see that. We have seen that roll back from that, so it is really important to highlight that one. Another issue I wanted to mention, that protection of the conducive environment for service provider. That is really important. We can see that those few countries, including in Europe, I don't want to name the countries, we see that civil society's space is shrinking. It's shrinking in a way also, the particularly colleagues who are working on drug policy or harm reduction issues who are working or campaigning for criminalization, they are being targeted. They are being targeted as quote unquote foreign agent. So we need to also raise this issue that conducive environment for the service provider, civil society, and professional as well, that how that should be also in the package discussion when we are discussing with different entity on the harm reduction, whether it is in Geneva, Vienna, or in our capital. We need to also think about civil society's conducive environment and protection. Thank you.
Yeah. Thank you, Zaved, for raising that. And I think it's, for sure, it can't be taken for granted, the ability for people to call for harm reduction in a number of contexts. But is there a question?
Hi, my name is Eric Dahlström. I'm with the European Law Student Association. And I wanted to say that I really like the perspective of the side event, and I appreciate a lot of the comments said by Anand. I'm here typing away and taking some notes, and I'm really appreciating all of that. But I can't help but notice how different it is from some of the conversations that we're having upstairs. For example, he mentions that he predicts that, I don't want to misquote you here, but you said something along the lines that human rights will dislodge the CND framework or the treaties that we have. So I'm wondering how we can progress from here when it feels like we're having two different conversations that are kind of incommensurable. That's my question. I hope it's not too big.
I think it is a big question. It's okay. I think there are a lot of big kind of issues raised by our speakers. So, Anand, would you like to answer?
We in the Global Commission on Drug Policy have been trying to work out a mechanism where we can actually go to an international court, take an advisory opinion that the treaties, the drug treaties, actually cannot mandate countries and states to forego their constitutional principles, like I explained earlier. For example, in common law and now mostly all countries, the burden of proof is on the person who asserts a fact. But in drug laws, they reverse the burden of proof. They say, you have to show that you are not in possession of a drug. So that's very difficult to prove the negative. Secondly, when it violates basic human rights, then those human rights actually have to trump a particular treaty. So those are the thinking, that is the line of thinking. If we can do it, it's not easy because states have agreed to go to, say, the Inter-American Court to ask for an advisory opinion. So we are thinking of trying to do something like that. But I don't want you to publicize it because it's, I hope the Chatham rules apply because it's a very sensitive issue for a lot of people. Oh, Chatham rules apply. So anyway, that's the line of thinking. So I have a lot of students who work with me. So this gentleman is interested in this issue. I'd welcome his intellectual contributions or anybody else. In fact, I wanted to ask Gloria, the doctor who spoke from New York. I teach in the US every fall, so I'll be visiting him in Washington.
I'm not a doctor. I'm a drug dealer.
I thought you said I'm a doctor from New York.
Some doctors are
I'm
drug
sorry.
dealers.
You're doing work better than a doctor anyway. So I would like to visit your clinics. I told Gloria to give you my email and phone number.
Okay, we can share Anand's contact details with you and with the person who asked the question too, Anand. Thank you. Actually, I think before I pass to Nara for closing remarks, is there, I don't know if would you like to comment at all, add anything? You do, Ahmed.
Yeah. Let me say, I really like always the remarks of us having a legal framework that protects the service provider for the harm reduction, and that's clearly that something that we cannot oppose. And as we do that also progressively, also let's ensure that we also come up with a legal framework that also protect the person who uses drug, because in many countries we are coming in Africa, we've seen a lot of disconnect between what the proponent of harm reduction within the state they are talking about versus the interior security. You find there is a law that protects the service provider, but there is nothing that protect the person who uses drugs, who is the recipient of the services. So I think when we address that, we should address it very carefully in terms of whoever is protected at the end of the day is the person who uses drugs, because there are no services if there are no people who use drugs, and you can have commodity, but if the people who use drugs are not visible, they are not able to come because of the bad policies, then we are still in trouble. Thank you, and over. Yeah.
Yes. Thank you, Anna, for bringing us back to the core of the issue at the heart of harm reduction too, moving forward. So I think we're very glad to have Ms. Nara here, Araujo from Brazil, as a champion of harm reduction, just to share some closing remarks. So Ms. Nara Araujo is from the Director of Prevention and Social Reinsertion and from the Ministry of Justice and Public Security in Brazil. So thank you.
Gloria, thank you very much for IDPC for inviting us to be here. It's a pleasure to be here, and it was a really good opportunity to listen to the colleagues who were here together in this side event. And I would like to I'll be very brief, but I would like to recall what we have been saying a lot and for a long time right now. That is what it's been said here at the report of the UN High Commissioner for Human Rights. It was said at the editorial of the Lancet Global Health in December, making a lot of reference to what the Call to Action report of the Global Commission on Drug Policy mentioned in December as well. The problem of the punitive approach of drug policies is not that they are itself a punitive approach, but because it affects disproportionately some people. They are not the same, they do not reach people in the same way. And we know, and we have been saying that a lot so far, that there are some people who are disproportionately affected by that. And when we look at women, we look at Black young people, as for example in my country, from marginalized communities. We look at traditional communities. They suffer a lot on punitive, and it's completely different from general population as a whole. I was asked to say some final remarks here from the place, from the chair of until I think 2 weeks ago, from the chair and the lead of the Friends of the HIV, group of Friends on HIV/AIDS. And I would like to mention that in my country, we have a public health that is supposed to be universal. And so we have for HIV, we have testing center, we have a network of services for testing, for prevention, prevention commodities, all the set of technologies available, PrEP, PEP, available for people on a universal basis, and treatment as well. But we still leave some people behind. And who are these people? And among these people, we have people who use drugs and living in more vulnerable contexts, because these people do not reach the services, although the services are available. And why do they not reach the services? Because we are sending the message through other public policies that they do not have the same right of other people. When we have a law enforcement policy that systematically stops, arrests, and incarcerates people, for example, young Black people from marginalized communities, we are saying they do not have the same right to the city, to freely circulate in the city. So how do we expect that these people believe that they have the right to access services? We are sending different messages in different public policies. So we really need to align the message. If it's universal, it's for everybody. Why some people have a disproportional approach when we are talking about drug policies. So we need to talk about it. And the best experiences that we have in the country as it regards to promoting access to HIV and in the health field, to health services in general to people, are those experiences where we do not have a vertical approach. We have an horizontal approach, and in those experiences, service providers, they were able and prepared to listen to these people demand. If it's a person who uses drugs, as Ahmed mentioned, that we need to listen and to involve actively people who use drugs when we develop, since the development of a public policy, in these experiences that we could effectively provide access to services, and including HIV services, there was a horizontal perspective of listening to these people and listening to what were their most urgent demands that sometimes were not in the field of health. They were other demands that they needed first before you offer access to health services. So that's it. As my final remarks, I would say that we need a more alignment among public policies we offer, sometimes in the same country, because you propose something to be universal, but on the other policies you are saying another message. You are saying it's not so universal. So if we need to guarantee access to public policies in general, we need to say and we need to send the same message. So thank you.
Thank you very much, Nara. And I think I'll probably leave it there. But yeah, can we give maybe just another round of applause for our wonderful speakers and panelists for joining today?